Okay. If you're ready, I'm starting the timer.
Okay.
Yes. Timer is on, and here is the question. Yes, so if you have read and understood the question, kindly tell me, what would you do with the patient? The patient is, yes?
To securing the airway,
Yes,
with the breathing and circulatory.
yes. Patient's record, yes, patient's record shows that patient was a known case of sickle cell disease, yes.
RTA will make a positive TLF.
Yes,
Securing has airway with cervical mobilization and check heart breathing.
yes, yes. All right. On CT scan, you discovered patient has a mass of 3.9 centimeter at temporal region, right? And this
Yes,
mass was discovered
anemia.
accidentally. Once you are trying to secure and save the
This patient has
patient,
just
yes. Sorry. Are you going to, once you're saving the life, are you going to operate
yes,
on the patient right away, or you are going to
discovered
stabilize?
incident.
Yes. Are you there? Or he got disconnected? Should I wait or should I? Yes. Anyone else? Dr. Fatumata, would you want to go ahead? Or Dr. Mohammed Radhi? I've stopped the timer. Can anyone define the term what is sickle cell disease? What is the significance of knowing? Yes.
Actually, sickle cell disease is a autosomal recessive hereditary common hereditary hemoglobinopathy in which
Yes.
the point mutation occurs in the beta chain of the hemoglobulin, which causes deoxygenation of the hemoglobin chain, and that causes the replacement of the valine with glutamic acid in the position 6, ma'am. So
Yes.
in that, for that reason, actually the hemoglobin gets sickle shape, that is called hemoglobin S, and that is associated with increased hemolysis, microvascular obstruction, and ischemia to different organs, ma'am. That is called sickle cell disease.
Can you tell me, you or anyone, all 10, 12 people, what are the complications, acute complications, or the painful crisis of sickle cell disease?
Yeah.
Yes.
Yeah.
Yes, please. Dr. Mohammed.
Yeah.
Anyone? Yes,
Yeah.
please.
Yeah. The complication.
Painful
The
crisis,
complication
yes.
of sickle cell disease as vaso-occlusive crisis and the sequestration crisis and the plastic crisis and the chronic tissue hypoxia can lead to damage to the spleen, heart, and kidney and lung, and increase susceptibility of the infection with encapsulated organism.
Very good. What is the surgical significance or relevance of knowing that the patient has sickle cell disease? And since doctor got disconnected, patient was RTA, and you have to stabilize the patient, and this is accidental discovery. So what is the significance or relevance of knowing that patient is sickle cell?
Patient might have gallstones.
Yes.
Or pulmonary hypertension and anemic heart failure.
Yes.
Also, maybe can have osteomyelitis.
Yes.
and patient might be hypoxic. All this can be management pre-operative and post-operative.
Yes, please. What about the hemoglobin?
Yes, he has
Yes,
low
please.
hemoglobin level.
Yes. So what are the risks that you expect during surgery?
We expect patients have hypertension as well as patient might need blood transfusion, adequate
Yes.
hydration.
Yes. How would you ensure, how would you make sure that hemoglobin remains at certain HP level? What would be the limit? What other precautions would you keep in your mind?
From 8 to the 9.
Yes, 9 to 10 gram per DL.
9,
What other
Yeah.
precautions would you keep in your mind? Use of tourniquets, okay?
Yeah, tourniquet. Yeah.
Yes.
yes,
So,
to
is there
communicate.
anything else which is
And also
contraindicated?
manage
Yes,
contraindicated if the
yes,
patient has infection and low hemoglobin level
yes.
and patient dehydrated.
Dehydration and hypoxia, very
Yes,
good. So, why is patient immunocompromised?
because the patient has autosplenectomy, he has
Yes,
increased chance of infection or encapsulated organisms such as Streptococcus pneumoniae
yes,
or Staph aureus.
yes. So, can you please tell me what is the most common primary brain tumor in elderly patients?
It can be either high grade or low grade. High grade such as medulloblastoma or
Yes,
glioma and glioblastoma multiforme. Low grade can be pineal tumor or
yes,
pituitary tumor
yes,
and or astrocytoma or
yes.
neurofibroma.
Very good. Can you please tell me what are the manifestations of brain tumor? Because this was accidental discovery.
It is depend on the location of the tumor and the rate of growth.
Yes,
Also, all tumor have space occupied lesion, so there is symptom of increased intracranial pressure, such as patient might be present with nausea and vomiting,
yes,
and projectile vomiting with headache, most commonly occur at morning. Also, there is maybe according to the location, if it is in the frontal lobe, patient may have personality change. If it's in the parietal, patient may have with motor dysfunction.
yes.
If it's in the temporal lobe, patient will have problem with the speech, dysphagia, or things like this.
Very good. Can you tell me what might be the natural history or the course of the primary brain tumor?
It is usually incidental, discovered incidentally,
Yes,
and the
yes,
symptoms occur suddenly.
yes,
These symptoms can occur many years before the diagnosis.
yes. If this patient had RTA, if patient has rhinorrhea, and if test is done and it shows it to contain glucose, so what would you interfere out of it? What is
Patient might
the
have
yes,
CSF leak, cerebrospinal fluid leak.
yes, communication or leak? Yes, very good.
Yeah.
Okay, if you will decide not to operate on this patient and leave this brain tumor, what might happen? What are the complications or risk factors that you expect to happen?
Patient might have brain herniation, which can lead to death.
Yes, very good. Okay, if you have done the biopsy and the patient shows that it's a squamous cell with keratinization, so what might be the relevance of knowing this?
Can be secondary metastasis,
Very good.
usually from the skin, can be squamous cell carcinoma of the skin or the cervix or
Yes,
the lung,
yes,
also head and neck squamous cell carcinoma,
yes, very good.
and squamous cell carcinoma of the oropharynx or the larynx.
Very good. Okay, and if post biopsy patient's wound is not healing, so what would be the most common organism that you would expect it to be there?
Salmonella.
No, Staphylococcus.
This patient has sickle cell.
Okay, this patient has sickle cell. I just asked randomly, not just this patient. Yes,
Okay.
you are correct. Yes, you are correct. Yes, yes. Good. Thank you. Excellent.
Thank you.
Where is the most possible the brain tumors metastasize to? The most common site or the possible?
Maybe through the lung, I don't know.
Or to the bones?
Bones, okay.
Why would they, this patient had sickle cell disease, so why would you think patient might have bone pain?
Because due to obstruction of the microcirculation
Very
by
good.
the sickle cells.
Yes, obstruction leading
Yeah.
to ischemia, yes.
Uh,
Very good, excellent, done.
Thank you.
Tremendous.
Hello, ma'am.
Yes?
The question was like, what is the most common organism for surgical site infection or wound infection, right?
Wound infection, after done biopsy, I asked. Wound is
Okay,
not
ma'am,
healing.
it always remains the Staph aureus most concern, but in case of osteomyelitis with sickle cell disease, that would be Salmonella.
Okay, thank you.
Okay, yeah,
Okay.
like most common Staph aureus, yeah.
Right.
Yes, he has done great, ma'am. Must
Yes,
I have said that.
everyone
Yeah.
everyone
Yeah.
has done good.